Motivational interviewing enhancement therapies. Motivational interviewing is a counseling approach designed to help individuals resolve ambivalence about their alcohol and or drug use, supports efforts to change it, and support efforts to change it. Motivational interviewing is often delivered as a brief intervention based on client-centered principles. Guided by these principles, MI emphasizes strategic use of common counseling skills such as reflective listening, summarizing, and paraphrasing. Advice is typically only given on request and with patient permission. MI is also sometimes combined with other types of interventions, for example, cognitive behavioral therapy, in order to enhance treatment retention and engagement. Motivational enhancement therapies, METs, are interventions based on the MI approach and practices. Unique to the METs is the use of clinically relevant patient-reported assessment data that is summarized and subsequently fed back to the patient in an MI-centered counseling style in order to enhance motivation for change. What happens in motivational interviewing and motivational enhancement therapy? The aim of combined motivational interviewing and motivational enhancement therapy is to increase patient motivation and commitment to reduce or quit using substances, usually over the course of 3 to 4 sessions. With this increased commitment to change, the patient is believed to be able to mobilize their own internal and external resources to facilitate change. MI/MET uses a specific interpersonal style that mixes open-ended questions and other common counseling techniques to facilitate behavioral change. Specifically, motivational interviewing employs clinical strategies such as reflective listening, expressing acceptance of patients' goals, selective reinforcement of talk that centers on substance use change, or change talk, helping the patient realize discrepancies between their values or goals and their actual behavior, monitoring of readiness to change, and affirmation of patient's freedom of choice. As part of MI, that's motivational interviewing, the patient might also engage in some written tasks, like considering both the benefits and costs of changing their substance use versus keeping it the same, known as decisional balance, as a decisional balance exercise. Perhaps the core tenet of motivational interviewing clinicians is that they do not argue in favor of change or attempt to convince patients that change is in his or her best interest. Rather, they elicit the patient's own arguments for change. That said, motivational enhancement therapy often involves offering direct advice based on available scientific research, giving the patient an opportunity to set their goals based on empirically informed clinical guidelines if they wish. For example, the lower relapse risks associated with abstinence versus moderate drinking as a path to alcohol use disorder remission. Examples of commonly used open-ended questions MET providers might ask to invoke, quote, change talk include, how might you like things to be different, end quote, quote, how does whatever it is interfere with things that you would like to do? Where does this leave you in terms of your drinking? What's your plan? What is the theory behind motivational interviewing and motivational enhancement therapy? Central assumptions in motivational interviewing. It is assumed that patients already have what they need to initiate and sustain changes in their substance use. Thus, the primary MI/MET treatment goal is to help patients resolve any ambivalence they may have about change and catalyze or mobilize that intrinsic motivation or commitment to make those changes. Note the difference in motivational interviewing from cognitive behavioral approaches, which assume that individuals lack the skills needed to initiate and sustain changes in their substance use but are already motivated to make the change. Number 2, ambivalence about change is the number one barrier to increasing healthy behaviors and or decreasing unhealthy behaviors. Number 3, different patients come to treatment with varying levels of readiness to change, and MI/MET is thought to address these individual patient differences based on Prochaska and De Clemente's trans-theoretical model of behavior change. it is assumed that working with patients that are not yet, quote, ready to change, i.e., they are in pre-contemplation or contemplation stages of change on how to reduce or quit substance use, will not be fruitful and likely produce resistance. The provider must focus first on enhancing motivation to change. Direct persuasion techniques, coercion, urgency, confrontation, argumentation, advice giving, blaming, labeling, etc., employed by mental health care providers are assumed to be ineffective and may actually inhibit patient change. Patient denial or resistance is not seen as an unhelpful trait of the client, but rather is considered to be valuable feedback to the clinician. That is, the clinician may be assuming a greater degree of readiness to change from the patient than is actually present at that time. The clinician-patient relationship is an equal partnership. The right of the patient to autonomy and freedom of choice from behavior, including any resulting consequences, are to be respected. What are the origins of motivational interviewing and motivational enhancement therapy? William R. Miller first alluded to the core foundations and concepts of modern-day motivational interviewing in a 1983 article published in Behavioral Psychotherapy, stemming from his clinical work with individuals who had alcohol-related problems. At the time, Miller's writing was in contrast with the more confrontational approaches common in residential substance use disorder treatment. Specifically, clinicians and potentially other patients directly challenged individuals about the severity of their drinking if they were resistant to the idea they had a problem. This was an effort to increase their motivation for abstinence, though Miller deducted this approach was potentially harmful, an observation ultimately supported by scientific research. Along with Stephen Rolich, Miller published the first seminal text outlining MI procedures in 1991, which is now in the third edition. Motivational enhancement therapy techniques have been tested as part of several randomized controlled trials comparing treatment for alcohol and other drug use disorders, including Project MATCH, that's MATCH, and the United Kingdom Alcohol Treatment Trial, that's UKATT. MIMET has also been combined with other types of interventions such as cognitive behavioral approaches, serving primarily as an initial way to enhance readiness to change substance use or to engage in treatment. Evidence for motivational interviewing and motivational enhancement therapy compared to